Ravi wakes up with a throbbing headache and body aches. He wants fast relief. Today we'll follow two different choices and what they might mean inside the body. First, Ravi swallows a standard painkiller tablet. In the mouth, saliva only wets it. There's almost no meaningful absorption here. It slides down the throat and esophagus, mostly just a transport route. In the stomach, the tablet breaks apart in acidic fluid, often around pH 1 to 2, releasing the active drug. For some people, that same irritation can trigger acidity, nausea, or discomfort, especially with frequent use or on an empty stomach. Next comes the small intestine, especially the duodenum and jejunum, the main absorption zone. Drug molecules pass into tiny blood vessels and enter circulation, now traveling throughout the body. Much of that blood flows first to the liver. This first pass metabolism uses liver enzymes to process the drug, sometimes weakening it and sometimes creating byproducts. Over time, repeated high-dose use of certain painkillers can stress the liver, especially with alcohol or other medicines. When the drug reaches the brain and nerves, many common painkillers reduce prostaglandins, chemical messengers involved in pain and inflammation. As that signaling drops, pain pathways quiet down, and the brain perceives less pain. The symptom can fade even if the root cause hasn't been fixed. Finally, the kidneys filter drug residues from the blood and send them out in urine. With long-term or excessive use, some painkillers can increase renal strain, especially in dehydration or existing kidney disease. So the allopathic path can be powerful and fast, but it demands respect, the right dose, the right timing, and medical guidance when needed. Now imagine Ravi chooses a homeopathic remedy instead. Tiny globules placed under the tongue. They dissolve in saliva and the mouth lining can absorb substances directly, bypassing stomach acid and the classic first pass route. Homeopathy, however, does not work like pharmacology in terms of measurable drug dose. Many remedies are ultra-diluted, often beyond what typical chemistry would predict. Practitioners describe the approach as individualized, matching a remedy to the person's overall symptom pattern. Supporters propose that when